Hi, my name is Frank Bryant with Medicare Gurus, and today I'm going to take a minute and show you the basic parts of Medicare so you understand better how it can help you and what you're getting. First slide we're going to be taking a look at is Medicare Part A hospitalization. Now, with Medicare Part A hospitalization, it's also called inpatient care. Now that means it helps cover your inpatient care in your hospitals, it helps cover your skilled nursing and hospice care, and also home health care. Also, one of the things that people don't understand is not really put into place. Just because you're in a hospital, it's not only Part A that is working. It also goes to our next slide, which is going to be Part B. Now, Part B is your medical insurance. It helps cover services that are from a doctor or other care providers. Also covers outpatient care, for example, when you go to a clinic, home health care, if you're recovering after a surgery or need some extra respite care, durable medical equipment, like your wheelchairs, your walkers, your canes, your other accessories. Also, it covers most of your preventative services, such as your cancer screening, colonoscopies, things of that nature that you want to do on a regular basis to make sure you stay healthy. It also, as I said before, will pay for your physicians and doctor services while you're an inpatient in a hospital. So when the doctor comes by and visits you, you're paying them out of Part B. Now on our next slide, we're going to be taking a look at is your drug coverage. Now, Part D is often misunderstood. Part D simply covers Part D drugs, for example, at-home maintenance drugs. Your blood pressure medications, your other your lisinoprils, your simvastatins, things of that nature. Now, it also can be used in certain instances when you're going and getting drugs administered to you in a professional medical environment, but generally speaking, those drugs are also covered as a medical service under Part B. It can get very confusing. That's why you want to go ahead and get a Medicare specialist to talk to you about it, because we can sort that all out for you. Now on the next slide over here, we're going to be talking about the two different parts of Medicare and the trajectories that you can take and when we're going to get your coverage. The first section is Original Medicare. Now Original Medicare includes your Part A and your Part B. You can also join a separate Medicare drug plan, which allows you to customize your drug coverage. There's a lot of different options in that space, so whatever you're taking, you'll be able to find the best thing for you. You can also use any doctor or hospital or treatment center in the United States that takes Medicare, which is a huge amount. It's upwards of 90% of all physicians that are general practitioners take Medicare, and it's an even higher percentage for people that are specialists, such as your cardiologist or your neurologist or things of that nature. It also helps you pay part of your out-of-pocket costs in Original Medicare. So, for example, most people hear about the 80-20. I want something to cover my 20% or I have to pay a 20%. That's what they're referring to. Now on our next slide, we're going to be talking about the other segment of this, the other line of care that you can take, which is a Medicare Advantage plan, and it's also known as a Medicare Part C. Now Medicare Advantage plans are a little different. What they do is they take your basic benefits that you have under Original Medicare, A and B, and then they put them all together, and then they license it out to a private healthcare company to run your Medicare benefits. And then oftentimes they include a drug plan. Sometimes they even have other benefits like dental or chiropractic and things of that nature. Now it's important to note that in most cases you're going to need to use the doctor's network that comes with that Advantage plan. Now for some people that can be no problem at all. Others that can be a bit of an issue, especially if your doctor decides not to take it in mid-year without notification, which can happen. Now one of the things you're also going to look at in the Advantage plans is that they do have a bit of a variance in what you can get. HMOs, PPOs, and also PFFSs. Each one has some different rules into what you can do. Also, each one has different rules in what your out-of-pocket liability will have. So again, it's important to give us a call or contact us so we can actually walk through the states of each one of those if that's an option for you. All right, so to recap, there's a lot of options and basic things that you can do when dealing with your Medicare. That's why it's important to go ahead and reach out to experts in the field, and specifically Medicare specialists, so we can help guide you through the process. Remember, no matter what way you choose, speaking to a specialist will allow you to get the most out of your benefits without having to spend too much. As always, I recommend calling 844-MY-GURUS or clicking on the link below and visiting our site where we can go through various scenarios for you. We can also give you lots of education material and show you rates for all the various companies. We have relationships with over 30 carriers, so we're able to give you a full spectrum of what's going on. So I hope you have a wonderful day, and thanks for spending some time with me.